I'm Alissa Fox, Senior Vice President at the Blue Cross Blue Shield Association. As you mentioned, the Blue Cross Blue Shield Association represents 39 Blue Cross Blue Shield plans across the country, and collectively we provide coverage to 102 million people. We're unique in that we provide coverage in every zip code and every part of the country, and all Blue plans offer coverage to small employers, a sign of our strong commitment to the small employer market. We believe that expanding coverage and improving affordability for small employers must be a centerpiece of healthcare reform. Today, I'd like to focus on three areas. First, I'd like to talk a little bit about how states regulate health insurance sold to small employers today. Second, highlight what Blue plans are doing to increase coverage for small employers. And third, outline our recommendations for federal legislation. Today, state and federal law require insurers to offer coverage to every small business, regardless of their employees' health. It's called guarantee issue. Every insurer has to offer coverage to small employers, and the small businesses can't have their coverage turned down or canceled if one of their employees becomes sick. That's both federal and state law. In addition, state law requires health plans today to pool all their small employers together when establishing premiums, and they limit the extent to which insurers can vary the premiums today based upon the health status of individual employees. These reforms spread the medical costs of all small employers more evenly to generate more affordable premiums for employers with less healthy members. However, this does result in higher premiums for the healthiest employers. As you've heard this morning, affordability is a central challenge facing small employers. To help address these challenges, our plans across the country have been pursuing two strategies. First, we're working on a variety of initiatives to rein in costs for everyone. Everyone is facing healthcare costs that are growing at much too higher rates. The initiatives we're pursuing range from changing the way we pay providers to promote better care, not just more services, and to focusing on prevention, wellness, and managing chronic illnesses. We have a website we just put online that highlights many of the Blue Cross Blue Shield initiatives underway in each of these areas. Second, our plans are developing special programs designed to make coverage more affordable for small employers. My formal statement includes several examples. I'd just like to highlight one. Blue Cross Blue Shield of Oklahoma worked closely with their state legislature to develop Insure Oklahoma, a program that provides subsidies to low-income workers in small businesses to help cover the cost of health insurance. This program has been very successful. To date, nearly 4,000 small employers are participating in the program, and more than 11,000 employees and their families receive subsidized coverage from the program. According to a recent survey, 56% of enrollees were previously uninsured, and 37% of employers offered coverage for the first time. While these types of programs are making a difference, federal action is needed to address the problems facing the small employer health insurance market as part of comprehensive health reform. We have three recommendations for your consideration. First, we're recommending legislation to encourage states to establish what we're calling state insurance marts to simplify shopping for small employers, increase competition among insurers, and help educate small employers on potential subsidy options. These marts would make it easier to shop for coverage by, for the first time, creating a central point in every state where a small employer knows they could go to identify what insurance options are in their marketplace and apply for coverage and for subsidies. Our vision is that you go to the one site. If you want to get, you fill out an application, one application, regardless if you're applying for Aetna or Blue Cross. You could check boxes. You want Aetna, Blue Cross, et cetera, price quotes. Push a button and get quotes pretty instantaneously. And then you could actually find out what subsidies you might be available and also enroll online. Second, we're recommending 4 types of targeted subsidies, including one patterned after the Oklahoma plan that I mentioned earlier that would provide tax credits to small employers for their low-wage workers. And third, we believe the underlying cost drivers in our current health care delivery must be addressed, and we have very specific recommendations in our Pathways to Covering America. Would like to close by saying reforming how we pay for and deliver care, it won't be easy, but it's the only way that affordability challenges facing small employers can be solved over the long term. We look forward to working with you, this committee, other members of Congress, the new administration, and other stakeholders to enact health care reform that works for everyone.